Welcome, everybody. We're so happy that you're here. My name is Nicole Douglas, and I'm a product marketing manager here at AvaSure. And today we're here to talk with you about something that's very exciting for our customers. We have yet another enhancement to our intelligent platform that delivers even deeper insights into your AvaSure program. So during this session, we're going to show you what's new with AvaSure Analytics. We'll share stories about how hospitals have used analytics data to drive improvements in their programs. And we'll also explore how AvaSure's customer success team can help you get insights in between the data points. Today's session will be recorded, and all attendees are automatically placed on mute. There will be time for Q&A at the end of the session, so if you do have questions throughout the discussion, please go ahead and put those into the chat function in the GoToWebinar console. Go to the next slide, please. All right, so you may have heard, we've been pretty busy lately. Over the past several months, we've been really dedicated to enhancing our virtual care platform to make sure that our customers have everything they need to deliver the best possible care and increase patient access to care. As virtual care has been rapidly emerging, we're making the right investments to empower you with the best tools possible. One recent milestone that we're really proud of is the launch of our newest episodic application. AvaSure Episodic is designed to connect patients with caregivers from everywhere, and that helps us support use cases like virtual nursing, like admission discharge, specialty virtual consults, and patient education. A lot of those use cases that you're seeing on the left side of this graphic here. This can really greatly benefit our customers by relieving the burden from bedside staff and improving patient access to care. But our commitment doesn't stop there. We've listened very closely to your feedback, and we're excited to show you our latest enhancement, which is the new analytics portal. This portal provides actionable intelligence, which helps our customers make more informed decisions and drive continuous improvement in their care practices. So our journey to empowering our customer with cutting-edge solutions will continue to be ongoing. When you partner with AvaSure, you can be certain that we are continuing to invest in our platform to make sure that you are equipped with the tools that you need to make waves in virtual care. Go to the next slide, please. All right, I'd like to pass it over to our speakers today. So first we have Jill Kaminsky. She is a clinical data and systems analyst here at AvaSure, and she really lives and breathes data, and she is the heart and soul behind AvaSure Analytics. Next, we have Lindsay DiBernardi. She is a customer success advisor and a registered nurse with over 18 years of experience at the bedside. Lindsay partners closely with our customers to make sure that they achieve their goals with their AvaSure programs. Now I'm going to pass it over to Lindsay to get us started. Lindsay, over to you.
Thank you so much, Nicole, and thank you all for joining today. We are so extremely excited about the launch of AvaSure Analytics. Over the years, we have heard from you all listening in today. We have been listening, compiling your feedback, and along with Jill Kaminsky's endless hours of work behind the scenes, this is honestly everything we've been dreaming of. So before Jill dives into the live demo of our new AvaSure Analytics and gives you the first sneak peek, I want to take a moment to remind you of or introduce you to the customer success team. The customer success team is comprised of customer success advisors like myself. We are a team of registered nurses. Every single one of us are with experience at multiple different clinical departments for bedside nursing. We have experience in clinical care application and in leadership and healthcare. Our resources, support, and services to you all are an included part of your program. We will partner with you lifelong in the post-go live phase. And really and truly, our main goal is to ensure that you have successful program outcomes and that you're meeting both your performance and operational goals. So to do that, what can we do? We do some of these items that are on the slide up here. We collaborate with you on things such as policy and workflow development or revisions to your current policies and workflows. We can provide education, training, resources that you may need. We can help guide you on evidence-based best practices. We can guide you on standard operations. We really take a deep dive into your program data and your analytics to help really identify areas for improvement and program optimization. Also, those metrics are really great to look at because we can recognize you for areas that you're performing exceptionally well, and it allows you to share those successes with the rest of your teams and hospitals. Also on our customer success teams are customer success specialists. They work alongside the advisors. We work in teams together, and they truly are navigational experts who can really provide you that non-clinical assistance. They help with organizing smooth transitions for any program support needs that you have. They can also be a great resource for you to expedite the most appropriate AvaSure resources that you may need as your hospital team. So really, we do welcome, encourage, we recommend you lean on us and our resources. We recommend establishing some regular cadence of calls with both the advisor and the specialist in your region. And of course, we're always available to you to contact us in the interim if needed. So without further ado, and to get you to the main event of the webinar, I'm going to pass it over to the extremely intelligent and exceptional Jill Kaminsky, but not without a very public thank you to you, Jill, for all this work that you've done with this.
Oh, thank you so much, Lindsay. You guys can tell from Lindsay and Nicole's opening there that we are extremely excited about this new analytics portal, and I'm so excited to be here with each of you today. You've all been such valuable members of AvaSure and Orna, and so we're excited to share these enhancements to the portal with you. I want to take just a quick second and step back in time for a minute. When AvaSure was just starting, the AvaSure clinicians would export the telesitter data from the customers. They would work on developing graphs and charts in Microsoft Excel, and then talk about these metrics of the telesitter program with the customers. Throughout this process, the AvaSure clinicians and the customers would discuss which metrics were most valuable to see in an analytics portal. And this is how Orna was developed in 2017. And so the AvaSure clinicians, or the AvaSure clinicians and the engineers, they worked together to develop the graphs in a portal that we proudly used for the past 7 years. So before I take a little bit further, I want to launch a quick poll. I just want to ask a quick question from our audience members. So we're going to bring that poll up. And it's going to ask you, how often do you check your AvaSure program metrics? So we'll just give that a few seconds and we'll go ahead and it's fun to watch the data change back and forth. Of course, I love watching data. Looks like a few of you are still answering. Okay, I think we can go ahead and end that poll and let's go ahead and see what the results are. The results were monthly. I'm not sure if that's able to show or not, the poll, but I wanted to just let you know. There was a few of you that looked at it daily, a few more that were weekly. The majority of you were monthly and then just a few quarterly as well. So in today's new analytics portal, it is designed to see the same trended data that you're used to in Orna, but it also allows for more actionable daily metrics at the care unit and VSA level. I think everyone's going to be so excited to see this. So let me go ahead. I'm going to share my screen and I'm just going to walk through that demo with you. When I log into the portal, I am brought to the sign-in screen. So I'm going to go ahead and click sign in and log in with my Microsoft account. And we're brought to the main page that has all of the graph selections on the left-hand side. You can see that it's the same 38 graphs that we had in Orna, plus we also added just a few additional extra ones to help with your program. I'm sure as the administrator of your telesitter and virtual nursing program, it won't be long before you'll be able to identify which graphs you'll want to use to help drive your program. If you have any questions about that, don't hesitate to reach out to your customer success team. So I'm just going to go ahead and take a look here at our patient demographics, and I'm going to click Reason for Monitoring. If you recall, in Orna, this used to be called Possible Adverse Events, but many of you had asked us if we could change the name back to reason for monitoring just because it was just a little bit confusing. So reason for monitoring is why you want to put a patient on a device. So what are you concerned about? What's the primary reason? Falls, elopement, maybe staff injury. So this is where that data is going to be. Before we begin with the data and the graphs, I want to just walk you through the layout of these graphs. In the upper left-hand corner is going to be your date range selection. Moving to the right here, we have the hospitals, and you'll have access to all of the hospitals that you should have access to. The next grouping here is going to be the hospital comparison, and we'll talk about that here in just a second. And then the next two data points are the total number of patients on the device, or total number of patients that are here on the graph in my date range, and then also the total comparison patients. Down here in our graph, I wanted to point out, if you recall in ORNA, the reasons for monitoring and reasons for discharge data was aggregated at the date range. And many of you had asked us if we could break that out so that you could see the trended data over time. So that's exactly what we did here. We broke this out so you can see it over the months. The first bar is going to be your hospital data, and then the second bar is going to be your hospital comparison data. So I'm going to go ahead and just choose, let's go ahead and choose AVA General to take a look at this data. You can see in February, 42% of my patients were admitted for falls on a device, and 70% of the comparison data was for falls. I'm going to go ahead and look at my comparison data here again. I want to point out, I'm not sure if you guys are aware of this or not, but AvaSure is the only database of its kind to have comparison data for telecity metrics. So it's very cool that we're able to do this. I'm going to go ahead and click Acute Care General Hospital. You notice that my data doesn't change a whole lot when I choose this comparison, and that's because the majority of the hospitals in the portal are acute care hospitals. But you can see it's still 42% for my hospital, 70% for my comparison data. I'm going to go ahead and change it to level 1 trauma. You can see the graph went blank. What that's telling us is that my hospital, Ava General, is not identified as a trauma 1 or a level 1 trauma hospital. So I'm not able to see that data. If that's an error and I should be able to compare to other level 1 trauma hospitals, just let your customer success team know and we can go ahead and fix that. So I'm going to go ahead and just bring all of this data back to how we started it. And I want to point out that the reason for monitoring, patient condition, patient risk factors, and then also the reasons for discharge, they're all set up the same way. So you'll be able to use them exactly the same way that I just showed you. I'm going to go ahead and close up these graphs here. Let's now go ahead and take a look at utilization. I'm going to click on utilization by site first. And I am hoping on the back end, I'm hearing a lot of hoo-hoos, cheerings, high fives from you guys. So many of you had asked, is there any way that I can see all of my sites' utilization side by side, just on one screen? And the answer is yes. Yes, you can. And here it is. So you can see I have all of my hospitals here. And if I scroll down, you can see them all side by side, their utilizations on one screen. Just a couple things I wanted to show here and point out to you. If I hover over this graph, and you can do this on any graph or any table within this portal, over in the right-hand side are these 3 little dots. I'm going to go ahead and click those dots. And you can see I have the option to sort this data. I can sort it by hospital name, I can sort it by utilization, or also by date. I'm going to go ahead and keep it sorted by utilization, but I want to look at ascending. And what it has done now is it's changed, and I am looking at my lowest utilizing hospital all the way down to my highest utilization hospitals. So just a couple different ways that you can sort data too. There's another feature I want to show you that we've been able to add into the portal, and it's data in a table form. So many of you like to see data visually with graphs, but also there's times where maybe a table makes more sense. So I just wanted to show you, this is my side-by-side hospital data in a table. And again, I'm going to go over here and click on those three little dots, and I'm going to click Export Data. And now what I have an option to do is export the data that's on the screen, and I can open that in Microsoft Excel or Google Sheets. And again, any graph or any table within this portal, you can export the data. Many of you might be saying, but Jill, is there any way that I can see my hospital data at an aggregate level? And yes, you absolutely can. If you don't want to see it site by site, but you want to see it at an aggregate level, you absolutely can. And that's right here, utilization by system. And you can see all of my hospitals selected, and this is what my aggregate utilization is. So that is our utilization. I wanted to also point out we still have in here patient count, patient hours. Many of you like to look at days instead of hours, so we just took the hours divided by 24 and we have patient day. And we also have length of stay by hours and day. But I'm going to open up patient count and show you how these graphs work because they are very interactable as well. So I have all of my hospitals side by side, and I have the number of patients that were monitored for each month. And then over here, it is broken down at the care unit level. So if I open this little box next to my hospital, Ava General, you can see 449 patients were monitored, 226 in the med surg, 142 in medical, and 81 in the ED. Now I want to show you how I can interact with this graph. I'm going to go ahead and click on the 226 patients that were monitored at Ava General in February 2024. So when I click on that, you can see my numbers changed over here. So now it's broken down at the care unit level again, just for February. If I click the 226 again, it clears that. Another way that we can look at this is, let's say I want to see how many patients are monitored in the ED. So I can click Ava General ED, and you can see each month how many patients were monitored in the ED. Again, I'll click on that to go ahead and clear it. And I'm going to just close up that box to close everything up. So again, total hours, patient days, and length of stay, all of these graphs are just like this. Again, you can hover over it and you can sort and you can export this data as well. We also have another graph for care units, and then you can also look at the hours by device. If you enter your data into the admin panel or administrator panel for one-to-one sitters, you would be able to see those graphs here. If you're not sure how to do that, your customer success team would be more than happy to show you how to do that. I'm going to move along to the staff intervention graph. So I'm going to go ahead and start with stat alarm. And I'm very excited to show you this graph, and I think you're going to really enjoy being able to look at this data at the care unit level now. So stat alarm response time at the care unit level. So this is my aggregate average stat alarm response time for all of my hospitals. And then down here, if I open the box next to my hospital name, I'm able to see the average stat alarm response time at the care unit level. Keep in mind, this is our demo data. It's just kind of a sandbox play data. So there's not a lot of variability to this data, but you'll be able to see the change in your stat alarm response time at the care unit level. If I click on January here, for example, I'm able to see, I'm just going to close my Ava General box here. I'm able to see the average stat alarm response time in January by hospital, and then also by care unit if needed. I'll click on January to clear that. If I open up Ava General and I want to look at my stat alarm response time for Ava General Medical, the dark red is my Ava General Medical stat alarm response time, and it's overlaid on top of the aggregate stat alarm response time, so all of my hospitals. So you can see how that care unit relates to the hospitals overall. Again, click that just to clear it. So super exciting stat alarm response time at the care unit level. I have something else incredibly exciting to show you for the staff interventions, and that is data at the VSA level. As you know, we did not have data at the VSA level in Orna, but we were able to put it into this portal. So we have stat alarm per patient day. We have it, this is the aggregate for all my hospitals. I have it down here to the hospital and care unit level as well. And then we have the number of stat alarms that each VSA had initiated in the state range. So I'm going to go ahead and look at my VSA number 88, and I'm going to click on this box to open up their data. I can see in this date range, they initiated 82 stat alarms, 60 at Ava General, 8 at Ava Enterprise, and so on. So this is a great way for you to educate, onboard, and most importantly, celebrate the VSAs within your hospital. AvaSure, you know, we're always looking for ways that we can help celebrate the VSAs as well with our Ava Prize. So as you're looking through this data and you see an outstanding VSA that's really doing hard work to keep patients safe, please reach out to the customer success team, and we would love to have you guys nominate them for an Ava Prize. So again, VSA data level at the VSA data, it's in the per patient day graphs. So we've got it in the stat alarms, it's going to be in the verbal interventions, and it's going to be in the pre-recorded announcements. So I'm going to close up those, and I want to show you another graph. I'm not sure how often you looked at the hour of day graphs in Orna, but for the staff interventions, I think they're so fitting to just to see how busy the VSAs are, when are they communicating or intervening with the patients. And so I just pulled up the verbal interventions by hour of day. And let's just go ahead and take a look at this real quickly. It's in military time, so from midnight to 2300. You can see the VSAs talk to the patients quite a bit around the midnight hour during 7A and 7P, which makes total sense. I'm sure that's probably shift change. And hopefully it's the VSA talking into the patient. Hi, Mr. Smith. I'm Jill. I'm going to be your patient safety monitor for the day. I'm just going to keep a watchful eye on you. Just make sure you don't fall. That kind of stuff, just introducing themselves. So go ahead and take a look at that by hour of day data just to see if it tells you anything about your telesitter program as well. Lastly, we do have the events prevented data in here. It's going to be at the count level, so you'll be able to see how many events the different VSAs are saving, patients from different harmful events. So we have the counts in there, so you're able to see at the hospital and care unit level and at the VSA level. And these are the Mr. Smith, please put your leg back into bed. I don't want you to fall. And I'm thinking, I just saved Mr. Smith from a fall. That's where this fall is going to be documented. And again, completely interactable. You can take a look at these at different care unit and hospital levels. The last set of graphs I wanted to share with you is from our episodic solution. So if you become part of our episodic solution, which is virtual nursing, physician consults, any other sort of clinical consults such as wound or respiratory care, then your data will eventually show up here in the analytics portal as well. And this is just going to simply tell us how many calls per month, calls by day of week, calls by hour of day, and any of the different types of calls. So let's look at discharge. These graphs are completely interactable too. We can see the day of week and the hour of day discharge calls are occurring. We can also take a look here at 8 a.m. There's a lot of calls at 8 a.m. Let's go ahead and click on that. and see what type of calls are occurring at 8 a.m. Oh, quite a few for purposeful rounding. So just those virtual nurses taking a look and doing rounds on a patient's. And then a lot of admissions as well. I can clear that too. So I just want to thank you for your time today. We're very, very excited about this portal. I hope you're just as excited. This is new to you guys. It's new to us. We're going to learn together. And as you're on your calls with your customer success team, we're here to train you, to guide you on this. And we feel so blessed to be able to help you guys use your data to improve your telesitter program. So I'm going to turn it back to Lindsay. She has some great customer success stories of how they've used their data to improve their process as well. So we'll talk in a bit.
That was so exciting to see live in person. The following stories I'm about to share really do close the loop on today's webinar content. But before we jump into those stories, I do have 3 of them. I do want to acknowledge that we do see your questions rolling in. We will address as many as we can in the Q&A at the end of this webinar. If you have questions, feel free to pop them in the chat. All right, so I'm going to take a moment to share with you the why we do and you do together as partners. The following are 3 customer success stories of ours who really did capitalize on using AvaSure analytics, utilizing clinical strategy, best practices, and they were able to achieve favorable outcomes that they desired. This first one comes to us from Fayetteville VA Medical Center. They had gone live and were following along on their metrics and recognized a challenge of consistent and persistent low utilization. We were able in the customer success department to engage with the team, the clinical team, and really identified that they had a new leadership. They had a new manager over the monitor station who was really just trying to gain their footing. And this is very common and very normal and very natural. And what we usually do see is a dip in utilization during that time, and that's to be expected. But some strategies to combat that low utilization was to really engage with that new lead. We were able to establish some frequent touch bases and calls between our customer success advisor, specialist, and the new leadership there. Very strong leader who was very engaged and ready to learn about the program, ready to discuss strategy, wanted to be trained on all of the data that she had available at her fingertips, provided some resources and updated workflows and policies. And we were able to really use those analytics to identify that they really did also have a lack of a gatekeeper. So really we're able to establish and identify somebody who could really help to gatekeep the program. Gatekeeper is really important. They can be an assistance to you as a manager or director when you can't be there 24/7. They are knowledgeable about the program, have a deep understanding, can really help assist and support with driving utilization, watching the dashboard, ensuring that you have high priority patients on devices, and can also help with triaging. So they established a gatekeeper and made sure that gatekeeper had a deep understanding of the program. They also took a look at their policy, and what we found was they had a very well-written policy. The gap identified was that the 2-hour required trial that they did have outlined in their policy was just not really being enforced. So did a little bit of work on their end to ensure that we had leadership and manager buy-in, that it was being enforced, and that trickled down to the bedside staff. And results of that, in an 8-month time frame, they were able to increase their utilization from 17% to 80%. And it is staying up in the 80s, as you can see on the graph on the right, in just 8 months. So super, super great work, a good story to show how we can collaborate and monitor your trends in AvaSure Analytics to have great success like this. Next slide, please. All right, this is SUNY Upstate University Hospital. This site actually had gone live And we're working the program well. We were doing some tracking of their sitter usage and looking at their AvaSure analytics very nicely. However, discovered over time that they continued to have high sitter usage and low utilization. And so really wanted to determine what were the barriers and challenges to this and why was this still occurring. They put some strategies in play. This group developed a sitter reduction task force amongst themselves internally. They were able to develop some screening tools. These screening tools really assisted and guided the nursing staff at the bedside to determine who was appropriate for video monitoring. They took a look at their policy and clearly defined inclusion and exclusion criteria. And on top of that, ensured that they clearly defined what was called failure criteria or unsuccessful criteria. So how do we know when a patient is unsuccessful on a device? To do that, they initiated a 2-hour trial program. So they originally did not require a 2-hour trial on the device, but decided that for a pilot, they were going to go ahead and do a 2-hour required trial as long as the patients were not in exclusion criteria. They decided to make this a little bit smaller with these new changes and did a pilot on 4 adult inpatient units, and also ensured that they had touch bases with leadership amongst each other in the hospital. So they had formal leader rounds daily. Continued to look at the data, continued to track and trend FTEs and sitter reduction and utilization. And during their pilot, we're happy to report that they decreased their sitter FTE by 2.0 across the 4 units. In turn, that saved them, or gave them back, I should say, 160 hours to patient care. So their one-to-one sitters were being pulled from the floors, being placed in one-to-one rooms, and they were able to give those bodies back to the floors for better quality patient care. They had 60% reduction on one of the pilot units that they rolled this out on. No adverse events were reported during the pilot. Decided to go hospital-wide, implemented the new policies and the new workflows, and reported a sitter reduction by an average of 7.1 FTEs per 2-week period, gave them back over 4,500 hours to patient care. And on the right-hand side is a metric that shows you that FTE 2-week average that they were able to produce. So really great work. And one more story we'd like to share comes to us from St. Luke's Hospital in Duluth. This team also had gone live with their program. Very strong group of leaders as well, very knowledgeable, deep understanding about the program. Set themselves up for success right off the bat by ensuring that they had a nice executive dashboard. We're really aligning their operational performance indicators, their analytics data, with their fall reduction and sitter reduction hours and rates. And over time, what they found is that in Q4 of 2022, after going live, they had an increase, a pretty good spike in their fall rates. Along with that, they took a peek at their analytics and discovered that their stat alarm response times were a little bit higher than normal for them. And so maybe we needed to take a look at the program and see if there was anything that needed to be revised or looked at. Super great. They reached out to the customer success team. We were able to work with them and supply them with our most up-to-date sample policies and our sample workflows and algorithms. And they did some revisions themselves. They really also decided that they needed to maybe do some refresher education to their bedside staff, to their floors, to their leaders, worked together on creating PowerPoint slide decks and pushed out a lot of education. Also, we're really great at sharing the analytics cross-organizationally. So hospital-wide, sharing the analytics brings awareness to the program, also level sets on where we have opportunities for optimization. And again, of course, looked at the operational performance and utilized best practices for their program. They had really remarkable results as well. From an operational and performance standpoint, you can see on the graphs on the right-hand side there, where in Q4 of 2022, they did have a spike in the stat alarm response times, but by Q1 of 2023, they had decreased their stat alarm response time from 15 seconds to 9. Also, their monitor techs were able to increase their number of verbal interventions, so they're communicating and redirecting patients. Those graphs are typically inversely related, and this shows the results of that. They were identified by the state of Minnesota to have the lowest fall rate in their state by Q3 of 2023. They have estimated from this program of fall prevention of over 500 falls a month. And they have decreased their fall rate. By Q4 of 2022 average, it was 3.5 to 1.56 by the end of Q1 2023. And on the next slide, another really pretty visual for this group of individuals shows you their spike in their fall rates at the end of that Q3, Q4 2022. That's when they reached out, did some work to take a look at their operational performance and really provided some education to their staff. And you can see that fall rate declining after they implemented some changes, leading to the metric on the right, which shows the fall rate being the lowest in their state. And they, of course, are the bar on the far right-hand side. That's teal. So great work, St. Luke's Duluth. All right. At this point, I'm going to hand it back over to you, Nicole.
Great. Thanks, Lindsay and Jill. Love to see the excellent results from our customers. So before we transition into Q&A, we want to make sure that you have a save the date for our upcoming annual customer symposium. That's going to be October 2nd through the 4th in Grand Rapids, Michigan. Jill and Lindsay will both be there if you want to dive a little bit deeper into analytics. And at these events, it's just always so good to get everybody together in person. We're going to have some great networking events. We'll talk virtual care, and we'll make sure that we're sharing best practices and make sure that your AvaSure programs are a success. So go ahead, mark your calendars, and be on the lookout for more information from AvaSure in the coming weeks. And now it's time to transition over to Q&A. All right, the most burning question we have, we'll get started with that one first. Is analytics available today, and how can I get access? Jill, could you take that?
Yes, absolutely. It is live. We are ready to go. If you're an active current Orna customer, you should have received an email from a Microsoft invitation email last Friday or Saturday inviting you to join the portal. If you did not receive that and you're an active participant in Orna, just let us know and we can get that invitation over to you. Again, reach out to customer success team at avasure.com. But no, it's live, it's ready to go. We're going to keep Orna up and running for just a couple months, just as everyone gets familiar with the new portal. But eventually we will take Orna down and the portal will be the portal of choice. So
great, thank you. Okay, Lindsay, this next question is for you. What kind of training is needed for the analytics portal, and how can I get my team additional training?
Oh, happy to answer that one. That's us in customer success. So just as we offered training before with the Orna database, we will do the same thing with this new AvaSure analytics. So if you need additional support, whether it just be functionality or you want to take a deep dive into any of the metrics for better understanding, that is us in customer success. So you could reach out to your customer success advisor in your region, or we do have an email that I believe Nicole will share at the end, customer success advisors at avasure.com, if you're uncertain who your customer success advisor is, and we can be sure we find the correct individual, but always happy to offer additional training and support for you.
Okay, thank you. All right, Jill, this next one's for you, and it's kind of a twofer here. So first, can we enter our own data into the analytics portal? And also, would it be possible to access or download the underlying workbooks so that we can use those for organizational specific analytics needs?
Okay, good question. And we get asked this a lot. I just want to state that security is incredibly important to us. So the analytics portal is locked down. You're not able to enter your own data into the portal. But through the administrator panel, you do have the option to export the CSV or JSON files to like implement into your own business intelligence portal. You can download, like I had mentioned in the demo, the data in each of the graphs, but if you wanted just like the full file of your telesitter program, that would be from the admin panel in a CSV or JSON format.
Great, thank you.
Yeah.
Okay, next question here. What is the lag time of the data, Jill?
Yes, absolutely. So the data, if you're part of the auto upload module, which 60% of our customers are, the data is uploaded on a daily basis. So it's ready for you each morning. If you are not part of the auto upload, which we would love to get you on that, then the data is uploaded monthly. And if you're unsure, again, reach out to customer success. We'll let you know if your data is monthly or daily.
Thank you. That helps to answer the next question that we had, is that someone said that they're currently getting monthly uploads. So to reach out
Yes.
to their customer success team to help make sure that you can get that every day.
Sure.
All right, seeing what other questions we have. Is there, Jill, is there a data dictionary that defines how the measures are calculated? Or if someone does have questions on how things are calculated, how can they find that information?
Yes, you can definitely reach out to me. I'd be more than happy to let you know, in a general sense, how we calculate the data. You know, this is proprietary for AvaSure, so I won't give you the entire secret sauce, but I definitely am here to help you and walk through the logic of how we calculate the metrics. We don't have a data dictionary per se, just because as our software changes, it would be a constant update, a constant keeping track of it. But the general, you know, how things are calculated, I'm more than happy to help with that.
Thank you.
Mhm.
I think this one would be similar. So who is managing the data and who do we contact when there are technical issues?
If there's technical issues, definitely reach out to customer care at avasure.com. And if it's something that they can take care of, they will. If not, they can always reach out to me and we can work together. So that's customer care at avasure.com. And that's our 24/7 support.
Great. So for technical issues, customer care, but for more like program-oriented issues or questions about things kind of between the data points, what I'm saying, that'll be customer success.
Yeah.
Thank you. All right, Lindsay, can our customer success advisors be on regular touch base meetings if requested?
Yes, 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 and yes. We recommend regular cadence of calls with all of our customers. So typically in a perfect setting, at a minimum, we'd like to touch base every quarter, but we are available to use some of our systems who are quite large, have many hubs and spokes that they monitor. We'll touch base every month, 30-minute touch base, take a look at your data. What are your challenges, struggles, barriers? How are we meeting your goals? If we're not, what can we work on? We can work together to develop success plans. So we really encourage remaining engaged with us. Again, it's an included part of your program. So that is our service to you. We're here for you. We are, again, clinical backgrounds ourselves. Many have worked in leadership and management in the hospitals as well. So please connect with us if you'd like to get on a regular cadence of calls.
Thank you. Jill, this next one's for you. Can we find the number of adverse events like falls during a certain period per site, or would we still need to reach out to AvaSure to obtain that information?
So the actual adverse event data we do not have in Orna yet. That is definitely on the roadmap, so we will be getting those graphs into Orna eventually. If you do want to see your adverse event data, you know, as I mentioned, that is part of the CSV export. So if you have export rights from your admin panel, you'll be able to export and look at those, and you can read the notes and see the time that those events occurred. Customer success team is absolutely equipped to show you how to download that CSV and read those or find those adverse events in the file.
Thank you, Jill. All right, we're coming up on the end of our time here, so just answer some of the last questions that we have. So if anyone did not receive their link, we've got your information here in the chat, so we'll make sure that somebody follows up with you. This meeting will be recorded. It'll be posted on AvaSure's YouTube channel following this session, and we'll also make sure that's included in the follow-up email that you will all get tomorrow. So again, if there's any questions that you have, you can reach out to customer success team at avasure.com. That will also be included in the email that's sent out tomorrow to make sure that you have that. But thank you everybody for joining us today. We're so excited to share this newest enhancement with you all. And Jill and Lindsay, thank you so much for sharing these insights with our customers. Thanks everybody for joining.
Absolutely.